Tamoxifen. The mechanism of action. Tamoxifen is a non-steroidal triphenylethylene derivative that binds to the estrogen receptor. It blocks the proliferative actions of estrogen on mammary epithelium. The mechanism is the tamoxifen induction of the synthesis of the negative autocrine regulatory molecule, which is the cytokine transforming growth factor beta. It has both estrogenic and anti-estrogenic action, which depends on its target tissue. Anti-estrogenic in mammary epithelium, as explained above, and can be used in prevention and treatment. Estrogenic in the uterine epithelium cause hyperplasia increase, and the estrogen and the result it would result in the estrogen increase as well. Tamoxifen can cause proliferation when bind to the estrogen receptor in endometrium. Tamoxifen can also lower the circulating levels of insulin-like growth factor, IGF-1. IGF-1 is a potent mitogen for breast cancer cells and may act by endocrine, paracrine, and autocrine routes to stimulate their growth. Tamoxifen is metabolized to more active forms by various cytokine P4050 enzymes like CYP2D6, CYP3A4, and CYP3A5, CYP2C9, and CYP2C19. Each metabolite has its own specific binding affinity for the ER. The tamoxifen derivatives with hydroxyl groups attached to their 4-carbon have the highest binding affinities to the ER. The UDP glucuronosyl transferase enzymes, primarily these and sulfotransferase enzymes, catalyze the conversion of tamoxifen metabolites into excretable forms. All enzymes in tamoxifen's metabolic pathway are polymorphic. Major side effects: increased tumor or bone pain, hot flashes, nausea, fatigue, mood swings, depression, headache, hair thinning. Hot flashes usually after chemotherapy. And most of these side effects after chemotherapy. My question is, to what % of the time should this drug be used to treat patients?